Hi, I'm Mark. Today we're going to be talking here at the Victor Valley Community College about some tough questions regarding nursing students and how the previous events have pretty much impacted upon them. So let's get to those questions. All right, today we've got Graciela.
Hello.
And I'm going to ask her a question and she's going to answer it. So, Graciela, teach your audience about a time when you were afraid and you were going to run out of resources given this pandemic.
So to answer your question, Mark, a time that I thought I was going to run out of resources was at the beginning of the pandemic. So when this all started, I wasn't sure whether I wasn't sure what was going on. We were all afraid of the unknown. We didn't know what was going on. I think the scariest part was walking into the stores. There was no toilet paper. There was nothing. And seeing like empty shelves. And I think internally, I think that's when I kind of panicked, not necessarily because I know I do have a lot of help and with family, friends, and I knew that they were going to help, but that was my fear of running out at the beginning. And I think a way of coping with that was just knowing that we were all going through it together, that we were all in the same thing, and that there was nothing that I could necessarily do to change it, but to just take it a day at a time.
So your family helped you cope through the loss of
my family and friends and just everyone in general, knowing that we were doing it together.
Was there anything that you did lost, like resource-wise, that you really wished you would have had?
Resource-wise, the toilet paper.
Toilet paper? That's an important one. That's an important one.
But yeah, and also there was like when the masks first came out, I didn't have one. I didn't know where to get one. I know people were making them, and I know that we have a nursing bag, the blue bag, the PPE. I remembered we got the PPE. There was a mask in there, and I used it. I used that mask. I was like, wow, I'm really stooping this low. But, you know, you got to do what you got to do. So
how did this affect your status as a nursing student?
So as a nursing student, for me personally, I knew that I still wanted to come to school regardless of the pandemic. I know that that's not the situation for everybody. And not everybody was able to return, not necessarily from our class, but other people that I did know. And also, like, I researched other schools, other places, and we were all going through the same thing. I remember we petitioned to get clinical sites, to get our clinical hours replaced with simulation hours. We had to basically take a semester off. And I think that was pretty hard. And I had to cope with it, you know, get through it. And I mean, we all had to go through it together. We all missed a semester, and it is kind of upsetting at first because we were going to be nurses in June, and it's kind of crazy to think, but we were, and now we have to wait until December. And so that's something that has affected us altogether.
I remember because we were in this last semester, the second semester, and we had gotten 6 weeks in, then boom, right before our second test, was it?
Yeah.
It was our second.
Honestly,
we were all happy about the second test.
I was happy. I was like, yes, I get more time to study, but we didn't know how long that was going to take. And so that excitement didn't last long. I was like, okay, we can go back now. And, you know, it's kind of, it sucks. And to be honest, it was actually quite harder for me to come back because of that long time, that long break. And I just felt like I wasn't fully concentrated. It wasn't the same. It was the distance learning. And so that was one of the big things for me as a nursing student.
Made it very difficult.
Yes.
Thank you so much for your time, Graciela.
Thank you.
All right. And up next, someone. All right, here we have Evelyn today, who's going to tell us some experiences that she's had. So can you tell us if you or someone you love got COVID, describe your feelings to what actually happened when they did get COVID.
So, I myself never did get COVID.
Yes.
Unfortunately, my mom, my dad, both my sisters, all 4 of my nieces, and my brother-in-law all got COVID.
That's a lot.
That's my immediate family.
That's oof.
And besides that, my boyfriend also his family got COVID, both of his parents, and unfortunately both of them passed away due to COVID.
Oh, wow, okay. That is pretty rough. How did that make you feel?
I felt helpless.
Helpless.
I felt pretty naive, I guess you can say, because I moved out of my dad's house in order to protect him and keep him safe. And my boyfriend was living with me in order to keep his parents safe, and it just felt like all our attempts had failed because everybody got sick regardless.
How was that impacting your view of becoming a registered nurse with your entire family getting COVID, your boyfriend's family getting COVID and passing? How did that make you feel when you thought of, oh, I'm going to become a nurse?
So his family passed away right before this semester resumed. So I had to stop for a minute, and I actually thought, is this really what I want to do? Am I ready to give my life over to a profession like nursing, where I know I'm going to come in contact, where I know I'm going to be on the front lines and I'm going to be expected to run in those rooms and help these people, even though the people I loved most, I couldn't help. The people I would have given anything to protect, I couldn't do anything. So I really had to stop and think, is this the course I really want to take? For a moment there, I really considered kind of throwing in the towel and maybe going in a different direction, because I didn't know if this was something I could handle emotionally. And overall, what ended up happening was I decided, that already happened. I can't help them. The only thing I can do is push forward and hopefully help somebody else and help another family so that they don't experience the loss that I experienced.
It's, going through that type of situation is going to be rough just for anyone, let alone trying to handle nursing school as well.
It was horrible.
Yeah.
It still is.
I mean, those lives can't just be replaced.
And I'm also trying to be the support system for him, because it's his loss, and I'm going to grieve it in my own way.
Absolutely.
But I'm trying to help him get through his process, and it's a lot.
It's a very large responsibility.
Yeah.
Very, very large. And you're a very, very big person to try and help with that. It's enormous. And I thank you very much for sharing with us.
Thank you, Mark.
All right, and welcome Leanne for coming on the show today. Thank you very much for being with us. Our question to you is, teach us ways that registered nurses might cope with the large number of sick and dying patients that they are being forced to encounter during this pandemic. It's got to be really, really difficult.
Yeah, so there's a lot of coping strategies that people use. One of the biggest ones people like to use is like therapy, group support. There's online group sessions now that people can do. You can do it over Zoom or whatever.
Because of the pandemic, you can't meet face to face anymore.
Right, so it helps to be a little more distant, but they still have group meetings in person for nurses. You can reach out to HR through your hospital and ask for what support services they offer. So they also facilitate those groups, and then you can talk with your charge nurse. A lot of them have access to those kind of resources, and they can help kind of keep an eye on you too.
Mm-hmm. Yeah, I know. Sister Mary Jo in my hospital. Love you, Sister Mary Jo.
Another thing people like to use is personal therapy or meditation, gratitude journaling, things like that. Help you focus on the good things that are going on instead of just dwelling on all the bad things, and give you a better mindset. I know for me, I use therapy and gratitude and meditation, and they help a lot.
What are some other things that people do to help cope? I know, at least for me, I enjoy talking with my fellow friends and other students like you and me, and I believe Ken, who's going to be on the show here. We usually have a little decompression session right after we work.
Yeah, checking in with coworkers can be really helpful. A lot of people develop a sense of humor in order to cope with all of the trauma.
I love dark sense of humor.
Another thing that people do is they exercise. A lot of people find that it's super helpful to just get all that stress out and go move. A healthy diet can be really helpful to decrease stress levels.
Healthy diet. So what exactly?
So things like eating vegetables, drinking your water, not just eating the junk food and the ramen that you want to.
But eating junk food does feel good from time to time, doesn't it?
It does, but it's better in the moment than it is in the long term.
True. Your body can only take so much.
Another thing that they suggest is to kind of restrict and limit how much exposure you have to news and social media, because there's lots of just negative inflowing from there, and that can really affect your mood too.
One of the things about the media, they were almost always posting about numbers that people died today in COVID land. That's uplifting. That was a joke.
More sense of humor.
Maybe a little bit. So, let's put you in a for instance. You're working on a telemetry floor, you have 4 patients, they're all COVID positive, and you know what? 2 out of 4 aren't going to make it. And you know that. And then you have to work with them all day, do the best you can to hopefully keep them going, but by the end of the day, you've had at least 2 codes run. And that's, many rounds of CPR, trying to get these people back. How do you feel after you've lost, 2 patients out of the 4?
Defeated, that's how I feel. But I just end up talking to people. That's the biggest one for me, is talking.
Talking it out.
I know they recommend that you don't take it home because it can add stress on your family and your relationships, but that's the best thing for me. I talk about it with my coworkers and get all of the gory details out of the way, but the stuff that really bothered me, I tend to take it home and have a conversation about it. My kids are old, they're teenagers, I can tell them some of it, and I can have a conversation with my husband and just tell him how I'm feeling and what went wrong, and generally just having another person with another set of eyes to say, no, you didn't do it wrong, it's not your fault that they died, can be really helpful. Charge nurses, instructors, having decompressions at the end of something like CPR can be really helpful too.
Yes, because do you believe it's possible to not take it home?
No, I don't.
No, I don't either.
I don't think it is. I've
Just-
never been able to not do it.
Yeah, there's just a part of yourself you can't detach from that you're doing.
Yeah.
So.
You can't be a different person at work than you are at home and expect that to not influence your relationship even worse.
True. Well, thank you very much, Leanne, for coming. And we'll get on to the next question. All right, here we are with Ken. And Ken, I'm going to ask you a question here. Tell me how the pandemic has changed your feelings about becoming a nurse. Tell me some of the things that changed because of the pandemic. And I'll probably ask you that again later. But so tell me about how the pandemic has changed your feeling about becoming a nurse as a nursing student.
So, as I think and have pondered about that particular question, some things that come to mind is I reflect back to 9/11. In 2001, I was working as an EMT on duty that day and saw the events transpire and listened to the radio as I was out running calls, hearing what was happening, and the heightened sense of security that we were placed into here on the West Coast, not sure if that was going to affect us. And it made me think and ponder about what would I do in that particular scenario. If we had an event take place here on the West Coast, was I willing to risk my life to go in to save others, knowing what was happening on the East Coast? So as the pandemic came through, again, I reflect back upon those same thoughts. Is it worth my life going out there and jeopardizing my health to save others? And initially it was scary to think about that. Much older now than I was 20 years ago when 9/11 hit, and I thought about much more in my life to live for, but again, it's a career path of giving back to others that I love. And at this time, I feel the same way, that God has blessed me with the skills and the abilities to help others, touch others, and be there in their time of need. And if I'm doing His will and what He wants me to do, He'll protect me and look over and after me as I continue to do this job in nursing. As we talk about some of the things that have changed prior to, again, as I said, as I work as a licensed vocational nurse, I primarily work in a home environment, home health setting. So I go into patients' home, physically see them, assess them, take care of their needs in their comfortable home environment and not in a clinical hospital environment. Some things that have changed greatly over time because of the pandemic is the rules and regulations that my company has set forth for my safety and the safety of my patients and their families and others. And some of that is nowadays, every time I go into a home, no matter whether they have COVID or anything else, I must now put on a gown, a plastic safety gown that I must wear during the whole time of my visit. Not only am I wearing my gown, I'm also required to wear an N95 mask through my whole visit. I have my gloves that I am to wear, and they've also asked that we wear a face shield as another form of protection, because as they've said with COVID, that the use of mask, and it's a droplet precaution, by wearing the face shield, that helps protect our eyes and keep that from a form of entry point for this virus into our body. These things do not breathe very well, as it is a plastic suit. By the end of my visit, sometimes in a home of being there for an hour, I do come out quite drenched and have to make sure I rehydrate myself. But in the bigger picture of the health and safety of everyone, it's well worth it. And I'm glad that there are parameters and measures out there to protect me and everybody else during this time of the pandemic.
And now it's just the requirements to keep both you and the patient safe have increased.
100%. And not only is it the patient, but because I'm in the home environment, anyone else that is in that home as well, making sure that they are all taken care of, because I am the stranger coming into their safety net. Because as we've been told, shelter in place, stay at home, but I have to go into their home, so I'm taking every precaution I can to protect them and me and turn into that environment.
And do you believe that we're going to progress forward with more protective equipment that we're going to have to wear in the future, or do you think it's going to remain about the same level?
As these infections change, absolutely. There definitely could be greater protections that we may have to wear in these types of situations. I can't think of some of them right now off the top of my head, because a lot is basic, and these pieces of equipment have been here for many years. Just we're having to use them a little bit more often than we have in the past.
Thank you very much, Ken.
Thank you.
You're welcome. And now, on to the next one. All right, here we are with Christian, and he's going to tell us a few things about his experiences as a nursing student. All right, so Christian, what are the dangers that come with the profession of registered nursing that you've been exposed to?
Wow, dangerous. I mean, I think when we go into the nursing field, we have that cliche thinking of the most dangerous thing that we're going to be doing all day is being around sick patients, which for the most part is 100% true. We could be going into a room that patient has some sort of infectious disease that we could be taking home to our families. We could be taking home to, or just going around and spreading it to other patients and our coworkers. And I think I speak for everyone when I say that COVID has definitely proven that to be true. I mean, I think to this day, we still don't fully understand the extent of this disease. And that was dangerous, just even going to work, just walking outside, going to the grocery store, and we just didn't know that much about it. And, you know, obviously just going into a patient's room, and not only do we have to deal with the infectious disease part of it, or just, you know, any type of sickness they might have, but we also have to deal with patients that are psych patients, inmates, or just flat out angry people sometimes that more often today are taking it out on medical staff. And that's dangerous, just going in there and not knowing what to expect, because all it takes is one comment and they're after you.
Yeah.
And which is scary. You know, we always have to keep our guard up all the time. But someone once told me, and it's really stuck with me, that we also have a license to potentially kill someone.
It's very true.
Because not only we could be given, you know, something as a medication that's saving their life, but all it takes is one med error and that life is ended.
Mm-hmm.
And that is so dangerous, just having someone's life in your hands. And nursing takes critical and precise thinking to where, you know, some people outside the medical field will never understand that kind of pressure.
Mm-hmm.
And it's very dangerous dealing with medications, certain procedures that we do, and we have to always just be on our toes. And let's face it, we're humans. You know, we always make mistakes.
Absolutely.
And being a nurse, you have to try to just keep those mistakes to a minimum.
Yes.
You know?
For example, we were in clinical yesterday, and standard procedure, standard everything. We were doing everything right, but the doctor did prescribe an antibiotic for the patient.
Yeah.
And it was standard. He had no known allergies. We checked many times, or the nurses and the staff checked many times, but he still had an allergic reaction that we did not know about, that the patient did not know about. And he went
Within
directly
minutes.
after that downhill.
Yep. And like I said, everything was done. Yeah, like I said, everything was done right. Everything was just standard procedure, and then within minutes, a code was called. And about the same time, it gave good perspective of just how quick everything happens. And let's face it, the medical field is a quick-paced profession.
Yes.
And with going fast, sometimes being fast means nothing if you're not proficient in it. You could be fast and, I can, do this within this amount of time, but it doesn't mean anything if you're going to put your patient in danger.
In the future, how do you believe that you're going to be able to cope with these dangers that are inherently present, especially things like COVID?
People cope in many different ways. For me personally, I feel like I tend to keep everything on the inside, and then when it eventually does come out, it's in a, quiet setting. But as far as coping, I think if this pandemic has taught us anything, is that being overworked is always a dangerous thing, because you're working 12-hour shifts, sometimes 3-4 days in a row, and no one can really think clearly on that little of sleep. Especially during a stressful pandemic, you're bound to make a mistake.
Absolutely.
So I think the way I would cope would be just to take time for myself, take time for my family, take time for my friends, because it's that kind of stuff that goes out the window when you can't take care of a person's life if you don't take care of your own.
Well, thank you for talking to us. And that's going to be it on the show here today. Thank you for watching and having all these questions. And make sure you hit that like and subscribe button down below, even though I don't know where this will be posted. Thank you. Hi, I'm Mark. Going to describe how my education was impacted by COVID. First off, one thing that really comes to mind is that I had to take a semester off. We got 6 weeks into our second semester of nursing, and that's when COVID hit last year, and school had to shut down. Now, it did shut down, and then we were forced to repeat the semester because we could not continue with our clinical sites, clinical hours, or anything like that. So it was disheartening having to start over again. At that point, we had almost been done with our med-surg rotation, and we were about to take another test, but they cut school, and that was for our safety and for everybody else's safety. That's what ended up happening. That pushed us back. I'm supposed to be graduating here, and it's May right now. June, I was supposed to graduate in June. Now I won't graduate till December. So, and a lot of things are still uncertain about that even now. We are still concerned about clinical rotations and facilities, how they've decreased the number of students that they're allowing entry, and we don't know if we're going to get all of our clinical sites in and clinical hours in, and I'm just not sure how it's going to end up, but I am hoping to graduate in December. It just feels like there are a lot of changes in the way of healthcare right now. Changes to the way everything's done, and I don't think that they're done changing either. So I'm trying to be on my feet and adapt to that as that comes, as teaching changes, as nursing changes, things like that. Vaccinations now. Now, pretty much in order to get into the clinical sites, we're going to need to have vaccinations, at least for next semester. It doesn't really matter. I already have mine as I work in healthcare already. So I had that ready to go because I knew it would be better that way. But there's been a lot of changes in our education system. And even with being more careful and all the PPE, we still, as students, got exposed to COVID. I was exposed to COVID, and myself, my clinical group, everybody was exposed to COVID and had to get tested before we could even come back to school. So that was really difficult and really stressful, wondering if I'm going to have to take another semester off after that because I was exposed and had to self-isolate. Fortunately, that came back negative within a few days, and I was allowed to return to school. But it's been difficult, really, really difficult, and just trying to push forward. Even with that, we still have other things to consider, like certifications. Like CPR is usually 2 years. Well, we started it with a 2-year program, but now we're 2.5. So we're gonna have to go get more certifications and spend money on that, which is another financial burden. It's not that much, but we didn't really plan to have to do that.
And currently, we're also trying to get our clinical sites and get our clinical rotations for psych, labor and delivery, pediatrics, things like that. And we're not sure if those sites are opening up. And quite honestly, it feels like the overseeing agency, the Board of Registered Nursing, doesn't seem to care that, for lack of a better words there, they don't seem to understand that we can't meet those requirements because of the way that the world has changed. And it makes it very frustrating and very stressful to even consider if we're going to be able to move on, even though we're doing everything we can as students to meet requirements. But without the assistance of an overseeing agency, we may not meet their requirements, as they have not been able to change during the COVID pandemic. We have been able to supplement some clinical site hours with simulation hours, but only a certain amount. And unless we get our clinical sites in line, we will not be able to complete our semester. We'll have to take an incomplete until we get those requirements completed, and that uncertainty is very difficult to progress with. I've got a test next week, but if I'm not going to be able to finish my clinical sites in 3 weeks, I don't get to pass the semester. So why should I continue to work really hard to study for my test when, even if I score well, I'm still not going to pass the semester? It's ridiculous, and it's very, very difficult to put forth that effort and have that eventuality, which we're hoping doesn't happen. Nursing school is already really, really hard, but to have all of the other things to take into consideration with COVID, with the pandemic, with the way things are to be done here in nursing now, it's just made it a little bit harder. But as students, we're supposed to meet those challenges, regardless of whether it's harder or not harder. We still have to get through if we want to be able to help, society as a whole. So we have to keep pushing through, adapt, and change the way we do things, and hopefully get it done right. What surprised me about the film? Not a whole lot. As I said, I work in healthcare. I've seen a lot of different people struggle with COVID in different ways, and I understand we're all having a rough time with it, and it's all really bad, but I'm still trying to work through it, slug through it, and get through it. And that's what I'm doing, and that's what everybody else I know is doing, despite the difficulty. So nothing in the film really surprised me. It was all kind of expected or anticipated at the very least.
What are the dangers that are inherent with registered nursing? And how do you intend to cope with these dangers?
There are lots of dangers that are inherent with registered nursing, unfortunately. A lot of these dangers are mental and or physical in nature. Sadly, some of the physical dangers deal with bodily harm, assault from altered patients, combative patients, and or their family members. There are other physical components from exposure to infectious diseases, body fluids, chemicals, and radiation, as well as the physical component of just the wear and tear that a nurse's body takes. They sustain a lot of damage to the joints of the knees, the hips, and the shoulders. I feel nurses can help mitigate a lot of these physical dangers by using their personal protective equipment religiously and properly, by staying up to date on the latest education, especially on infectious diseases. They can help prevent them by using help when moving patients and proper assistive devices. Another massive danger that came about this last year was the COVID-19 virus. I found it quite scary that I could contract this virus simply by trying to help our patients and provide good patient care. Contracting it would mean putting my own health and my life at risk. What I found was horrific is the fact that I could bring this virus home and jeopardize the health and lives of my loved ones. I feel nurses can help mitigate the dangers of the COVID-19 virus by, again, using their personal protective equipment, how it was designed to be used, and religiously using it, as well as always washing and sanitizing their hands, especially before and after patient care, by wearing masks, and by practicing social distancing. Another massive layer of protection that nurses can add to their lives is the vaccine to the COVID-19 virus. When the vaccine first came about, I'll admit I was very skeptical on this vaccine. It just seemed way too fast how it was developed and put into distribution. But through doing some of my own personal research, consulting with a good friend of mine that's an ER physician, and most importantly, consulting with my wife that's a 10-year ER nurse, I truly came to believe that the benefit of receiving the vaccine greatly outweighed the risk of not getting it. One of the last components of danger that nurses face is a mental component. It's very unforeseen in nature. Nurses give everything they have to their patients, everything physically, mentally, and spiritually. If nurses don't practice safe boundaries, they can burn through all their reserves and have nothing left to give themselves or even their families when they get home. I believe that these dangers can be mitigated by learning good boundaries, by having a life outside work, and simply being able to leave work at work. It's very important that we learn to take care of ourselves, because if we're not okay, it can be next to impossible to provide good patient care and help our patients overcome their problems.
How was your well-being affected by the pandemic, and what were some lifestyle changes, if any, and how did that affect your family?
I feel like going through the pandemic didn't affect me directly, since I work in the nursing field already. I wasn't canceled. I was still an essential worker. My husband's a diesel mechanic. He's still an essential worker. So we got up, went to work. Our routine basically stayed the same. However, when they closed down the schools, I have a 10-year-old and a 13-year-old. 13-year-old seems to be handling it a little bit better, but doesn't have the socialization that he craves. And the 10-year-old was having almost daily meltdowns, not being able to see friends, not being able to talk to people, being stuck inside the house all day. As far as the lifestyle, we did try to do the whole quarantine, stay at home as much as possible. When we weren't working, we were at home. But when we saw how that affected our kids and being stuck inside and going through the depression and the anxiety and not knowing how to handle his emotions, we changed it completely. And we would do the masks and be safe with it, but take him out places. Try to go to the park where he could ride his bike, be outside where they're not around a lot of people. School was not going well with him. And that's how it affected me, was trying to, after work, come home and help my son with his homework and his schoolwork and help him catch up on all the stuff that he missed all day. And dealing with him saying he's stupid and that he doesn't understand. And at one point actually said he should kill himself because he's stupid. So, sorry. That's more how it affected me, was as a mom, and seeing how it affected my kids, and that's what hurt. So we totally had to change how we did everything and kind of go against, not fully against the regulations, but making sure that our friends who felt the same way that we did, that we hung out with them so he could hang out with his friends, that he could have the socialization and have the support of other people. And more recently, we have gotten him into a private school so that he's in class every day, and there has been a complete 180-degree change in him. He doesn't have the anger issues he had. He's not super emotional anymore. To an extent, a 10-year-old is always going to be. But and seeing how he was to how he is now, it's completely different. And looking up, there's been multiple studies that suggest there's been an increase in the suicidal ideations and suicide attempts in young children and adolescents in the ages between like 11 and 21, just from the pandemic. And one report from the CDC also stated that the mental health related, like emergency room visits, increased 24% in children from 5 to 11 and 31% in children from 12 to 17 compared to the same time in 2019. And it's dealing with stress, anxiety, PTSD, panic disorder. So I can see where my kid fit into that, not knowing how to handle the situations because their kids are so young and they don't know how to handle it, how we can handle it. And even adults have a hard time dealing with all this stuff, as you can clearly see. But yeah, so I mean, lifestyle, we tried to adjust it, but it was affecting our kids too bad. So we kind of had to go back to a pre-pandemic as much as possible so that our kids could handle it. Because that's how it affected me, was just seeing my kids go through it and not being able to do stuff you want to be able to do as a mom to fix it. So that's all it was.
In what ways might RNs cope with a large number of sick and dying patients encountered during this pandemic?
Before I answer that question, can you imagine this? Being a nursing student and just being in the ER for the first time and hearing that a COVID patient is actually coming in and they're working on them as far as doing CPR, and you're like, okay, cool, I can possibly just watch from a distance, be safe. And when they actually bring in the patient and you see them working on them, you just there and you just don't know what to think, or you just feel helpless. And that's just it. As a nursing student, right now we actually can't go into help those patients. And I could just imagine what an actual nurse actually feels like dealing with this every day. They more than likely just feel like there's not much that they could either do, especially getting a patient that is that far gone because you're having to do CPR on them. After being in that actual situation, I actually took the time out and I actually spoke to one of the nurses who were actually working in the ER at that time. And I asked them this precise question that you actually asked me. And he told me that he actually speaks to his mom, and that's his way of coping with and gripping like what's going on right now. He speaks to her because she's actually a fellow nurse. She works on the labor and delivery floor, and it just helps him to just speak out his feelings and what he's gone through. That's his way of actually coping with all of this. But there are other ways that you can actually cope with the situation and handle the stress a little bit more, like taking time to unwind, like either doing something that you enjoy doing with your significant other, maybe a friend, as long as you guys are socially distanced, as well as unhealthy behaviors probably wouldn't want to do with being a nurse, like drinking. That's one way of handling stress. But there are also other healthy ways, like you can go for a bike ride, you can exercise, walking outside, hiking. Hate doing that stuff, but yes, they're there. And just take care of your body. Just try to take time to de-stress. Take time for yourself. Drink water. Breathe. Just natural things to help with your mind and your body, and that can definitely help lower your stress and help you cope better with all.
A time during the pandemic that you were afraid you were going to or did run out of resources, and how did you cope?
Yeah, I actually did run out of a very important resource, which was money. So my hours got cut at work at the beginning of the shutdown, and I had to go on unemployment for about a month before my hours picked back up. So in that first month, I was really scared because, no money means I can't pay my bills. I can't go to the grocery store to get my food. So I had to dip into my savings, which, I was very lucky to have because that's what kept me afloat with the unemployment as well for that month. And then my hours picked back up. So after that, I was off of unemployment, and, I consider myself very lucky and very fortunate that that scare was just very temporary. But I know for others it wasn't as good.
And how is your status as a nursing student impacted?
So right before the shutdown, we had clinicals still, and that was when, everybody was first hearing about COVID, and that was when PPEs were running out, N95s were pretty much nowhere to be found. So I was seeing all the nurses have to reuse their N95s, which is, you know, those masks are supposed to be disposable, one-time use, and these nurses had to literally just disinfect it however they could and rewear it. And our semester was canceled, and that was probably the biggest bummer because, it's something that's out of our control that just puts us behind. And I know as a nursing student, I want to help. I wanted to not only continue on with clinicals in school just so I could be that much closer to getting my degree and then eventually getting my license and, being part of the healthcare workforce in order to get through this pandemic together. But I understand that they canceled the semester for safety reasons, of course. But that was the biggest impact that it had on my status as a student.
What are some unexpected positives of attending school during quarantine?
So something I found online on scholarshipamerica.org, pros to online learning during the pandemic provides benefits of easing financial burden of traditional college in ways like saving money on gas by not having to commute to campus, not spending as much money on eating out, not having to pay for childcare, not missing more hours of work to accommodate for day-long in-class lectures, just being able to learn in the comfort of a familiar space like my own home, which I found was a big positive during this pandemic. It added more convenience for myself along with other classmates that I've had discussions with about this topic, especially during the COVID pandemic. Another big one for me is just availability, being more available for my family and for my children, being able to help them also navigate just doing school virtually during the pandemic. Overall, just having more time in the day, I found a big positive that I've experienced during the pandemic. The main one for me personally was just being able to slow down. It was really important. It was something that was really unexpected that I experienced attending school during quarantine, was just not always having to be on the move during the semester, not always having to be at the next place or have a whole packed schedule of having to be just away from home, away from my family, and having more time to be able to be more present. This allowed me to have more time to be able to take in things around me, reflect on what really matters, just to be more attentive to my own mental space and putting goals into perspective, and being able to learn how to be more disciplined and stay focused in getting studying done and assignments and prep work done, especially being a nursing student, particularly during the COVID pandemic.
What were some frustrations encountered by nursing students while they're in quarantine?
In the beginning, during the quarantine in place order, students were no longer allowed to go to school. We were 4 weeks into the semester, we had to stop completely. The year was no guidance for the faculty in order how to accommodate a hybrid curriculum with the nursing students. We're going into a field where we take care of people, and you kind of have to get close in order to do an assessment. You have to get close to people in order just to talk to them, and we weren't allowed to. You can't socially distance in a skill lab or in clinical. So they weren't able to get us into a hybrid setup, but this trickled down through many different aspects. Most of our nursing students are also parents. These parents were then having to their kids were having to go to hybrid setups. So now you're trying to juggle who's going to have the computer, do we have the internet resources, who's going to watch the kids, who's going to sit with them. Because when we did finally come back, we were able to do socially distanced skill labs. Who was going to watch your kids while you were here on campus? Who was going to make sure they got their stuff done? You juggled both. You took care of everything. And it took a long time, but everybody kind of started to realize that this was all just a circumstance that we had to work with. And everybody came together and we all worked it out and moving on.
Hello, my name is Andrea Garcia and I am an NP3 student. So one of the biggest frustrations that I first encountered while using Zoom was actually trying to figure out how to use Zoom. Me and myself, I'm not very tech savvy, so it was kind of hard for me at the beginning to understand how it worked and understand the mute button and the unmute button and then the video button and the non-video button and then making sure you're muted while your professors are talking. So that was a little challenging at first, but it's gotten better so far. Another frustration that I have is that I can't really learn on Zoom. It's very hard for me to keep focus while basically watching a computer. You know, I learn better in a classroom face-to-face with the instructor. So that has been, I would say, the most challenging is, you know, staying focused and learning on Zoom. I interviewed a few different students from different processes, and one of the biggest frustrations that they had was the internet connection. You know, when everything's running smoothly through lecture, then all of a sudden their internet cuts out, and then they miss important pieces for the test. And yeah, that's I noticed that was one of the biggest frustrations amongst other students. And then another big one was being distracted, like getting distracted at home. You know, a lot of these students do have kids that are also on Zoom. So, you know, when we're trying to listen to lecture, you know, being parents, they also have to, you know, make sure their kids are focusing on their Zoom and their lectures. So yeah, I guess being distracted is another big one that I noticed amongst our nursing students.
Hi, my name is Brittany Smith. I'm an NP3 nursing student. A time I thought we were going to run out of resources, I would say, would be related to the most recent pandemic we have had, being that everybody was afraid and was trying to get supplies and items to protect themselves and their health. We ran out of things like tissue or hand sanitizer, soap, Clorox wipes, even the necessity to simple as water because of the scare of it not being available. I coped with the same way I guess others did. I tried my best to find alternative means to gather supplies as far as hand sanitizer, hygiene items, things like paper towel, tissue of that nature to protect my family in the event the resources did leave or they were scarce or we didn't know when they were going to be replenished again. So that way we could have, you know, the necessary things that we needed just in case. I feel like it kind of impacted my status as a nursing student because, I mean, everything comes down to clinical hours at the end of the day. So I felt like if some of the hospitals or locations didn't have enough resources as far as things like PPE gear or gloves or shields and things like that, we weren't going to be able to be allowed on the facility because obviously their nurses and their workers are going to come first. So then as a nursing student, if we aren't able to complete those hours because we don't have that rotation because of lack of resources with things, like I said, sanitizer and gloves and things, we would potentially not be able to progress to the next phase. And then we're like sitting ducks in nursing school waiting to see if we can obtain a clinical site to be able to go there. But luckily, the resources have been of abundance again, even during the pandemic, and that hasn't been a definite standstill in the nursing school.
Hi, my name is Anna. I'm nursing process 3. Even though COVID was very tragic, it definitely provided me with more time towards myself and my family. I was able to watch movies, I was able to go out, I was able to enjoy myself without having to worry about homework or studying or anything like that. So it definitely brought my inner peace high up. I'll say my sleeping pattern kind of changed, but not a lot. Because instead of studying, studying up late, I would stay up watching TV, which was more of a luxury because I never get to watch TV, so it felt really good. Before the pandemic, wouldn't really cook a lot. I would only cook maybe once a week. And once the pandemic hit, I went to cooking twice a week. Maybe sometimes 3, my family was lucky, but then we went back to eating out because we thought, oh, maybe we should eat out and, just in case food runs out, we should run their food first and then our food. Lifestyle choices, we didn't really make a lot. I mean, like I said, we just I think they were mainly happy that I was able to provide myself, more towards them, like quality wise. I was able to do more things with them, but there wasn't a lot to do anyways because everything was closed. So I think that was yes, I had more time to myself, but then again, there wasn't much to do besides going out and hiking and off-roading and stuff like that. But I will say that's the only thing that my quality of life changed. The pandemic also offered me time to spend with my newborn. I had my son in May, so I was able to stay home with him since school was closed and actually enjoy the bonding time between him and I, and my other son too, and with my family, so I was able to be there with them.
Hi, my name is Veronica Luviano, nursing process 3. Yes, I did and I still do. Pre-COVID, it was already really hard for me to find private places to study because I have 3 little kids who require my attention more than anybody else's. So before, I used to, when they were at school, that was my time to study and to concentrate on the things that I needed. But once COVID happened, not only were my kids home, but my husband was home and my parents were home working from home. So all my babysitters were now working from home, and it made it a lot harder to find quiet places to study. So nowadays, the way I find quiet places to study is I have to send my kids to their room to watch TV or movies or play on their iPads or their iPods, which I really hate having to do, but I don't have many options anymore. I go and study with friends and use their quiet house. I will send my kids to work with my husband so they could go sit in his classroom. Or when my kids are at their practice, I have to stay back and not go so I can study. Or if I absolutely have to go and my husband isn't able to take them, I sit in my car and I take my books and I read and I take notes. So the barriers that I have are mom guilt for the same reasons that I'm sending my kids to their room. I'm asking them to stay in their room, or I feel like now that COVID's happened in a weird way and school at the same time, I'm spending less time with my family or less quality time with my family. So we're all in the same space, but I'm asking everybody to go be quiet or go to their room or just go somewhere so I could be alone, or I have to leave so I can study and focus on the things that I need to focus on. So it's a lot of mom guilt, and I find that asking other parents that are in school, especially like my friends that are in nursing school or in this class, they feel the same way. It's a lot of mom guilt because we're just not there like as present for our kids, like, and it's a lot of added stress because not only am I trying to teach myself, but I become like a homeschool teacher, and I'm trying to make sure my kids are on track and they're not falling behind and they're doing what they need to do and they're still doing good in school. So that's a lot of barriers, a lot of added stress.
My name is Christian Warren, and I'm an MP3 student. So before the pandemic, I was headfirst going into the nursing field. I wanted to become a nurse because I've been a caregiver for about 12 years now, and I really loved it. I loved the learning. I loved helping people. I loved the differences that I made in people's lives. So I knew this was something that I wanted to go into. I didn't really want to be on the front lines. I didn't want to be a first responder. I didn't want to be like an EMT, a firefighter, or a police officer. I didn't want to be one of them because they walk into situations that can sometimes risk their lives. I didn't want to risk my life to save somebody else, but I wanted to help save people. So I made sure that nothing was going to change that. It didn't matter what barriers I hit. It didn't matter if it was financial, if it was babysitting, transportation. I always made it work no matter what. So this was always going to be my plan A. I never had a plan B. So when I knew that this was something I wanted to do, I knew I would be safe because I didn't have to risk my life. I didn't have to jeopardize my life or my family's life in any kind of way. So I was safe knowing that I was going home to my family again. But after the pandemic hit, I was scared just like everybody else. I bought things out of panic. I had hand sanitizer everywhere, all over my house, in my purse, in my car. I disinfected the house every single day. Even if I had somebody over, I stayed my distance from them, but I would sanitize the house as soon as they left. I did not want to leave. I stayed in my house for maybe 2 months straight before I actually went outside again. And it was challenging, but I knew that me and my son were safe. I ended up having another baby. And now all I can think about is what would happen to him if something happened to me. So when we got the word that we was going back to school, I didn't know if I really wanted to go back to school because I want to be able to be there for my kids. I know that a lot of people who are susceptible of getting this virus is people of brown color, people of a certain blood type, people who have underlying health conditions, and I have all three of those. So after thinking about it for so long, if I really wanted to go back to school, I had to make a decision if I wanted that recognition to be somewhat of a hero, of putting myself in risk to save others and not being as selfish. I mean, it's okay to be selfish, but when it comes to saving other people's lives, you kind of have to think unselfishly because that person wants to go home to their family too. They want to live. So they need our help. I have to think that if I put myself at risk and I'm saving theirs, it's not just our lives that we're putting at risk, but it's also our families. And I need to think like, well, where would my kids go if something happens? You know, if they'll be safe, or will they be okay? Will they think different of me for choosing to put myself at risk to not be there with them, or would they be proud of me knowing that I did something to help somebody else, even though it could possibly cost me my life? So I made that decision, and I think that nursing students are just as important as nurses are, because we're still fighting to help people regardless of what's going to happen. And we still get that appreciation and recognition from the public, because even wearing a nursing student uniform, people still appreciate me and thank me for doing something, even though a lot of people out there can't or won't do it. So I decided to stay and fight.
Hi, my name is Dana Lamelli, and I am an MP3 student. With no prior medical experience in the healthcare field, my experiences were primarily based off of what I've learned through my schooling and my many clinical hours at the bedside. I was excited to always perform newly learned skills, whether that was inserting an IV, an NG tube, prior semesters caring for isolation patients, and even something as simple as just standing in there and being a listening ear or being able to talk to my patients. I have never personally experienced death within my career so far, within schooling, and that is something that now these nurses are dealing with on a regular basis. I never feared my safety while in the clinical area. I always felt protected. I always had the proper equipment, gloves, masks, shields, you name it. It was there and available for me. I knew that I would have help in the room when it came down to it. And I always knew that I was to go home after my shift and I had time to recuperate before my next clinical shift the following week. I felt encouraged as a student to grow and experience those new things, like taking care of that isolation patient, to put myself in that situation and gain that experience for my future nursing career. At the start of the pandemic, seeing the healthcare system become totally and absolutely overwhelmed, I felt very down on myself as a student. I felt like I had this knowledge and skills that I could use to help, and that just wasn't the case. In December of 2020, my great-grandpa was admitted to the ICU due to COVID complications. And for the next 20 days, those nurses became our lifeline. It was a time of grieving for our family and learning, as we now had to navigate his ICU stay through a phone call from a nurse, a phone call from a doctor, his medication regimen, the treatments that were being used in his care, the numerous explanations that we would need as a family to reassure us. Those nurses taught me more than they will ever know, even as a nursing student, and I hope to carry those core values with me through my nursing career, such as compassion and respect to all patients, provide the privacy, do the oral care, change the sheets, turn them, and do everything in your power to protect that patient when they can't do it themselves. Courage to stand up for your patients and be that advocate. Patience to call the family and take time to explain and teach them, or a Zoom call so a family can communicate with them or maybe see their loved one for the last time. Patience to stay a little while, hold that hand, talk to them, listen to them, encourage them every step of the way, because you might be that last face, the last voice, or the last touch that that patient experiences. Strength to show up each day despite the challenges, with an open mind and determination to care for your patients to the absolute best of your ability. And the knowledge that you too deserve a break, someone to talk to, time to break away and time to be you. My great-grandpa was never alone in that ICU. He was never not talked to, never not cared for. Those nurses gave their all until his passing on December 20th of 2020, and I could never thank them enough. My drive to become a nurse is even greater than before because of those nurses. During this time, there have been periods of mourning, waiting, trusting, listening, and learning. I've seen the toll that COVID's taken on the healthcare system, on the healthcare workers, and it breaks my heart. The gut and determination these nurses have displayed through such a hard time, the losses they've endured on a daily basis, and the pain encourage me to keep on going so I can come alongside them as a nurse one day, fully competent, fully knowledgeable, and able to do everything I can to do what's best for my patient. I am determined to be that nurse for someone, to demonstrate compassion, patience, courage, and strength in everything that I do. I am determined to be that team player and encourage those around me and future nurses to come to do the same.
Hello, my name is Omar and I'm an MP3 student. Briefly describe how your own education was impacted by COVID. The biggest way that COVID impacted my education was by delaying my class's graduation date. So we were expected to graduate this upcoming June, but because of the COVID events, we will now be finishing in December. Nursing school is already stressful and hard as it is, and having to repeat part of a semester that we had already completed was very disheartening. Not only that, but the quality of our education has also been impacted because we now have less time to practice our skills in lab. And also we have very limited clinical sites in order to obtain the clinical hours that we need to graduate this program. But we are resourceful, just like any nurse should be, and I'm confident that my class will graduate becoming the best nurses that we can be. What surprised you about the responses you recorded? What surprised me the most about the responses that I recorded was how much my classmates who have children have to deal with. Nursing school is a full-time job in itself, and I can't imagine the level of energy, time, and sacrifice that they have to make to be able to get through this program. I have a lot of respect for those classmates because they have to juggle many roles, and seeing them getting it done motivates me even more.
Okay, so Lisa, what are some strategies you would teach an audience that might address people's refusal to wear masks and hand washing while in public? Any precautions?
Yeah, well, first of all, let's look at why people are refusing to wear masks. So there's political reasons. There's a group of people that distrust our government and the information they're being given. And there's also a group of people that want to have a sense of control. And in a chaotic world that we're in, we could understand why people would want to have a sense of control. So some strategies would be to make masks readily available when they go into stores or establishments. Refuse services such as no shirt, no shoes, no mask. Or we could recommend that they put their political affiliation or social expression on their mask so they still feel like they're supporting their position. So the CDC and the World Health Organization have encouraged mask wearing by sharing scientific data, giving relevant visuals, and reliable resources. But the fourth thing that doesn't seem to be being touched on is applying to emotion or appealing to emotion. And that's really where I want to focus. So as healthcare professionals, that's the essence of who we are. It's having compassion, empathy, understanding, and really listening to people. And we want to be able to take that information and correlate it in a way that they will be able to make their own decisions based off of experiences that they've already had. So let's say, for instance, that you're talking to Mr. And he shares with you that he prefers to go commando style. And for whatever reason, maybe his own personal freedom, but he also shares with you that a spider has crawled up and bit him and his family jewels. So this would be the perfect opportunity to have compassion and empathy, because you could understand that this experience was probably very painful and embarrassing for him. And to correlate that he's putting himself at the same risk by not wearing a mask, that this virus could invade his body and wreak even more havoc or pain or discomfort. So it might be difficult for us to discern whether or not he's going to conform to social norms, such as wearing underwear. We know that that's a social expectation, and that might be hard for us to monitor, but perhaps he'll make a different choice to wear a mask and take those precautions to protect himself. So let's keep the spiders out of our pants and the virus out of our body, and everybody protect themselves by wearing a mask.
So, Erica, do you work in healthcare?
Yes, I work in a local hospital in ICU.
How did you feel about becoming a nurse before the pandemic?
Well, from a young age, I knew I wanted to be a nurse. Prior to the pandemic, I wanted to be a nurse to make a difference, and I really enjoy caring for people. Being that I'm in the healthcare field, I've been able to see how being a nurse, like how it's affected the nurses throughout the pandemic, whether it was working overtime. Some nurses were working 4 to 6 days a week, staying hours after their shifts, lack of supplies. We ran out of IV pumps, tubing, N95s, just PPE, and the emotional toll that it really took on the nurses of losing so many patients in a short amount of time.
Okay, so now that you've been through the worst part of the pandemic, have your feelings changed about becoming a nurse?
I still really want to be a nurse. My feelings haven't changed. I still want to make a difference and take care of people. I enjoy that. But my reason why is a little bit different. I want to be a part of a community of nurses that help each other and work as a team. And that's really what I saw at work, with the nurses coming together during hard times and really just pushing forward. Even if someone was drowning, they still would go help each other. And that's why I want to be a nurse. That's what I want to be a part of.
Education was affected mostly because I was forced to stop and repeat a semester due to the lack of clinical sites. This in turn affected my hands-on experience within a hospital setting. What surprised me most about the responses I recorded was how adaptable the students have been during the pandemic. Nursing school is hard, but nursing school during a pandemic, that's another level of difficulty. And despite all the challenges, it appears the students have remained optimistic and resilient in confronting every obstacle head-on.